For my elective surgical patients, they'll be usually arriving at the outpatient surgical center prior to surgery that morning. They'll go to the pre-op area where the anesthesiologist will talk to them about either a local IV sedation type of anesthesia or a general anesthesia. I will then be identifying the patient and reviewing the procedures, the risks, the follow-up, and the complications. I'll be identifying the extremity or the foot that we're going to be operating on, talk about the local anesthetic and the IV sedation, and then talking about what to expect during the procedure, and then what to expect post-operatively when they come back to the recovery room, as well as going over what they need to know when they go home with their post-operative care. For my post-operative patients, it's important to remember that foot surgery does involve some discomfort level. So for the first 48 hours, they may need some pain medication. It may involve some anti-inflammatory medication, trying to stay off their feet for 48 hours, using ice to keep the swelling down. Depending upon the surgery that was performed, returning back to their day-to-day life may entail physical therapy starting in the second or third week, improving range of motion of what we operated on. For the bunion procedure or for the hammer toe procedure or any other general foot surgery. But for the diabetic, it may involve quite a commitment of follow-up visits for wound care. That wound care may become very intensive. It may involve the use of grafts or skin substitutes. It may involve repeated surgical intervention where they have to go back to the hospital for another procedure. It may involve the use of a wound vac or negative wound therapy. And for that, home health care may be involved, coming to their home and treating them on a daily or every other day basis.